Hey everyone, my name is Dr. Hong Lee with Dr. Lee House Calls. I'm a house call chiropractor located in Metairie, Louisiana. In this video, I'm going to be teaching you how to do neck mobility exercises and stretches. So this is for anyone that's been dealing with neck pain, discomfort, stiffness. Now, of course, if you were involved in any type of traumatic injury, like a car accident or had whiplash, make sure you go check with your doctor to make sure that you don't have anything serious going on and that these exercises are safe to do. Okay. Now, a foundation for a healthy neck is mobility. The reason why is because our neck is made up of several joints, and then if you don't use those joints, you don't move them, it'll start to develop immobility. It'll start to get locked up, develop stiffness. It could lead to pain, discomfort, and then you can even irritate the nerves in the neck, and then it can cause numbness and tingling into the hands or arms. Okay. Now, what can cause mobility or lack of mobility in your neck? It could be from previous injuries, such as a car accident, but most of the time is due to chronic poor posture, because nowadays we're always looking down at a computer or looking down at a phone or iPad, and when we have this poor posture, our head comes forward, our shoulders will start to round forward, and this will cause lack of mobility in your neck. Okay, so let me show you in the model of the spine. So in the neck, you have 7 bones, and where the bones come together, it forms a joint, the facet joints. So let me zoom in here so you can see. So for example, right here, okay, so you have a bone here and a bone here. When the bone comes together, it forms a facet joint. And these joints, they allow for motion of your neck. You see how it moves? So whenever you look down and up or turn your head or bend side to side, these joints allow for that motion. And when you don't use that motion, it starts to develop problems, degenerative problems in your neck. Now, I recommend that you do these exercises every single day, first thing in the morning. And also you make sure you want to do them throughout the day as well. So if you've been working on a computer for too long or looking down for too long, take a break. It only takes about 2 minutes to do this to mobilize your neck. Okay. Now, the other thing is that you want to make sure if you have any type of pinching while you're doing this exercise, I would recommend that you go see a chiropractor or a physical therapist to get an exam to see what's causing the pinching type of pain. Now, first thing is that you want to make sure you have good posture while you're doing these exercises. So you want to make sure that the shoulders are relaxed and your shoulders are back, and make sure your head is over your shoulders. You don't want to have your head forward. Have your head over your shoulders. And there's going to be 4 ranges of motion that we're going to go into work. So we're going to work on flexion extension, which is looking down and up, and then lateral flexion, which is bending your head side to side. And then we're going to work rotation, which is looking left and right. And then we're going to do some chin tucks to work on the head forward posture. So let's do flexion extension first. So we're going to be doing about 30 seconds per range of motion. So have good posture, have your chest up, head over your shoulders, and then you're going to bring your chin down. So you're going to look down. This is flexion. And then you're going to bring your head back and look up, extension. So you can do about 30 seconds of this. Okay, and once you get done with that, then you're going to do lateral flexion, which is side to side. You're going to bring your ear towards your shoulders. Make sure your shoulders are relaxed. You don't want to have your ears up or your shoulders up like that. Then side to side. And the biggest mistake that most patients make is that they start to turn their head with this exercise. And the reason why is because we don't use this range of motion in our day-to-day basis, right? We're always looking left and right, looking down and up. So to make up for that lack of range of motion, I'll see patients start to turn their head. They'll do this. So make sure that you're looking straight forward and you're bending your head to the side like this. Okay? So if you start to notice that your chin comes down, you want to make sure you correct that and have your chin up like this. Okay? All right, so you're going to do side to side. After you get done with that, you're going to work on the rotation, which is turning. So you're going to look left and right. And then the other thing that I forgot to mention is that when you do this first thing in the morning, most of us are more stiff in the morning. So you want to make sure you take it easy and get warmed up. You don't want to push it too far. You want to do a couple where you're not pushing, just within the range of motion that is pain-free. Once you get warmed up, you can push it a little bit further. Okay? Now the last range of motion exercise is going to be chin tucks. This is going to strengthen the muscles in the front of the neck, which is called the deep flexors of the neck. And this is going to help to have a better posture so you can hold your head over your shoulders. Make sure you have good posture, chest up. And when you're doing this exercise, your chin needs to be parallel with the floor. So you don't want to have your head coming back like this or down like this, okay? Chest up helps to place your fingers on your chin. And you're going to tuck your chin back. Hold it for about 1 to 2 seconds. And then relax. Tuck your chin back, relax. Okay. After that exercise, we're going to move into some stretches. Whenever we have poor posture, the muscles in the front of the neck will get tight. So what you're going to do is you're going to take your hands, place it on your collarbone and pull down. And then you're going to gently bring your head back. Make sure you take deep breaths that helps to relax the muscles. This feels really good. You're going to feel that in front of your neck. And then you're going to turn your head to the side. You're going to get one side of the neck and then the other side. Okay? And then the last stretch, you're going to do a side bend like this to get the side of the neck. Make sure your shoulders relax. Hold that for about 30 seconds to a minute. And then you can even place your hand on the side of the head and pull to get a deeper stretch. Take deep breaths. And then a little bit more advanced stretch. You can even take a light weight, like 5 pounds or so, to traction that shoulder down to get an even deeper stretch. Okay, so those are the mobility exercises and stretches to do. I recommend doing these every single day. That way you can keep your spine healthy and slow down the degenerative processes and that develops over time as we age. If you have any questions, feel free to leave a comment in the comment section below. Again, my name is Dr. Hong Lee with Dr. Lee House Calls. I'll leave my website information in the description of the video if you're interested in having a chiropractor come out to you to provide chiropractic care in the comfort of your home or workplace. Feel free to give me a call. Thanks for watching. Have a great day.